In Chapter 2, we're going to talk about how to handle an emergency. Emergency situations come up a lot, and sometimes as innocent bystanders, we have to know how to react, specifically if we're trained in first aid. Emergencies that are dangerous, they can be unusual and rare. Everyone is different. You don't see it coming, and they're of an urgent matter. So a bystander has to really assess the scene and look at what's happening, recognize the emergency, decide if they need to help, call 911 if they need to, and also check the injured or ill person and decide if they're going to give first aid. Sometimes bystanders don't help when they're in public places because they just may not have the knowledge. They're confused about what the emergency is. They don't have that training that people with first aid certification do have. So sometimes the quality of aid that they can offer can be inadequate or dangerous. So poor decisions can be made. And sometimes they may know some first aid procedures, but their certification isn't current, so it might be outdated and they're using antiquated procedures. So if you are a first aid provider and you're current in your skill and in your certification, you should be confident and as a bystander in taking action. But you have to recognize the emergency. Is it severe? How long has the person been down? What are the scene conditions? What does that person look like? Are they a relative of yours or just a stranger? Lots of different things to consider. And you have to decide to help. If you can feel like you're able to help this person or people, you have to feel confident about doing that and be willing to take the time to help. You have to put those potential risks of helping that person in perspective and feel comfortable that you're doing the right thing for them and helping them. If you feel that helping them would be more harmful and it's not worth the effort, then you have to decide, well, maybe this is too advanced. It's beyond my scope of practice. I need to do something, take other action, like calling 911 and engaging the emergency medical system. Wrong decisions can be waiting too long to call them, and if you call them sooner, that person could be saved. Even once you do, call 911, check that injured person, and if you can give first aid, that's what you want to do. When you do call 911, you have to let them know, is this a life-threatening condition? Is it getting worse? And what will happen if you move that injured person? Will they get further injury? And does this person, based on my description, actually need EMS, or am I, as a lay person, first aid responder, able to give that first aid to the person? And these things are questions that you have to go through in your mind over and over to determine whether or not you are the right person for this. So this has to be done in a quick matter because remember, time is of the essence when we're trying to treat patients that are injured or ill.